which of the following is most appropriate? Next step management. Okay. Master recipe, ketogenic diet. Okay. 15-year-old girl with history of epilepsy is brought to the emergency department for increased frequency of her seizures. She has been experiencing sudden episodes of muscle weakness and collapsing, which have led to several falls. Her anti-epileptic medication regimen includes valproic acid and lamotrigine. Vital signs are within limits. There are no focal neurological deficits on examination. What is the most appropriate management? What is the problem? Why did she come here though? Just increase in frequency of them. Hmm. I'm not really sure. I'm not really sure what to do here.
Yeah, this is a very tricky question for sure.
I mean, you could check the anti-epileptic drug levels, but that I don't know if that's really a thing. You could do an EEG, an imaging study, see if there's something else, like especially if you said an increased frequency in these seizures and collapsing a lot. There could be something going on that you really don't want to miss, like you said before, like a cancer or something. I
So
don't
was it
know if
what
this
is
is
an
a
EEG catch that? So what is EEG, by the way?
EEG is no, that's like the where you see like the brain waves,
Yeah. So that's not gonna catch
like
any.
on like the skull cap thing, right? Like the
Yep.
skull cap.
Yep. So that's not gonna catch
Um,
too much anatomical things, right? That's more MRI or CT.
no, yeah, that's gonna see, yeah, if you have like seizure levels or something. Ketogenic diet, I don't think is what we're talking about here. Administering the benzodiazepine, I don't think she's in a current epileptic state, which I think that's what you would do.
Okay.
And then as opposed, and then the last one switching to, I'm guessing that's another um anti-epileptic drug that I'm not sure about.
Okay.
That last switch to
The tyrosine.
levetiracetam. So yeah, I would just check to see if if she's taking these
Yeah,
as
so a good
stated.
thing, right, is you wanna make sure, right, if the valproic acid and lamotrigine, if they are at therapeutic levels, right?
Okay.
She might not be taking a high enough dose, which is what's causing the epilepsy, so you can start that, right?
Okay.
Keto, just so you know, for your information, ketogenic diet, right? This is if they'll describe even a child or an adult that's been through multiple epileptic medications, seizure medications, maxed out and everything, still
Hmm.
gets seizures, then a ketogenic diet can actually help. Just
I
so
didn't
you
know
know,
that. Okay.
okay, it's an adjunct, right? EEG, like we
Mm-hmm.
talked about, it's good for diagnosing epilepsy, but we already know that this
Mm-hmm.
patient has epilepsy, so no reason to confirm what we already know, right?
Okay.
And then like you said, lorazepam, right? That's usually acute seizures or status epilepticus, right?
Mhm.
But patient doesn't come in with seizures, right? And then switching to a
Right.
monotherapy, right? And so if one doesn't work, right, then it's probably not the most appropriate next step. You need to figure out why these medications aren't working before you take them off and put them
Right.
on one thing, right? So
Okay.